Are you looking to expand your aesthetic practice and attract high-quality new patients? Discover the power of digital marketing in growing your practice with a personalized strategy session. Schedule your meeting today by visiting www.businessofesthetics.org/MSM and take the first step towards transforming your practice with the potential of digital marketing.
Well, I have a very special guest today on the Business of Aesthetics podcast. Today, we have Dr. Kachare. Mel, thanks so much for joining us today. We had the opportunity of meeting at the St. Louis course this past fall. And for those of you who don't know you yet, since you're in the very early part of your career, give us kind of a rundown of what your background is and where you're practicing today.
Yeah, thanks for having me on this podcast. So my name is Mel, and I actually grew up in New York. So I did the longer path for plastic surgery. I actually, after medical school, I did general surgery for 5 years, and then I did my plastics trainings for 3 years, and actually did an aesthetic fellowship as well. And then now, from that and all my mentors, I got connected with Dr. Nayak, and now I'm here in St. Louis. And I joined Dr. Nayak as a partner in his practice, and that's actually where we met when he had his October course for his cadaver course that he does every year.
And how long ago did you join him?
I started in September, so only about 5 months ago.
Okay. And I will say, from an outsider's perspective, he has done a great job of promoting you. It looked like the onboarding process was very loving and friendly and not necessarily what we see in this industry sometimes. When
Mhm.
you think about junior surgeons joining senior surgeons, I think the divorce rate is higher than that of marriages in the United States. So give us a sense of, why did you decide to join him versus another surgeon, or start on your own, or join a hospital-based group? Walk us through that whole process. I'm sure it started, you know, even during your fellowship potentially.
Yeah, so for me, I got very lucky. I had amazing mentors. When I started my plastic surgery fellowship at Louisville in Kentucky. And so during those 3 years, I got close to a lot of my, obviously my hospital and academic surgeons, but three of the surgeons I got really close with were my private surgeons, or actually more than three. One was Dr. Calabrese, who's obviously well known for breast, and even his junior associate partner at the time, Dr. Chet Mays, who has now started off in his own practice. And then Dr. O'Daniel, who's been one of my biggest mentors, who's also big in the facial aesthetics, but he's a full plastic surgeon. And another private plastic surgeon, Dr. Salzman. They really took me under their wing. They really gave me a lot of mentorship. And from that point, I initially was thinking, what should I do? As you said, I started early thinking I definitely wanted to do aesthetics. Should I do more in like the normal path of how we were always told to go into the hospital or take call, do some reconstruction, and slowly phase into it? But all of them said that times have changed and you can go directly into aesthetics. And so from that point, I was looking at what my options were about joining someone or starting my own. Nearing the end, Dr. O'Daniel was saying, hey, I have one of my good friends who actually has a fellowship in aesthetic surgery, and he is really tapped into the International Society, or the ISAPS, and you can get a really great experience and really encounter how surgery is done in different parts of the country or different parts of the world, actually. And he said it would be a beneficial year for me. So he connected me with Dr. Sozer, who I spent a year with out in Texas, in El Paso. And I will say that it was a phenomenal year. I did see a lot of different types of body contouring, different facial aesthetics, and it really just added a lot more to my armamentarium of what I could offer and just what my education. And then after that was a big decision, as to come back to your question of how did I choose. So I had been talking to Dr. O'Daniel. I had also been talking to Dr. Sozer, and joining them would have been great. They both have private practices. They're amazing. And at least for Dr. Sozer, El Paso just wasn't this. I'm from New York. It wasn't really the city that I could see myself landing in. And then I had thought about Dr. O'Daniel for a long time. He does full plastics. He's a great mentor. He's been more than anything to me. He's pretty much like a second set of parents for me, him and his wife. But initially we had talked about, I was like, Louisville, I did like the city, but I wasn't 100% sure. The other thing is, as you said, joining a senior surgeon, you're always worried because every single person I have that's a colleague has given me a nightmare story. And I had a long list of things that once I ever got to the contract phase, of questions I should ask or things I should put in my contract, things that we never think about when we're in training. And so I did also have that little fear that I told him that he was my mentor. Will I ever be seen as a partner or a colleague? Would I always be that trainee to him? But we had a lot of talks, and he actually just gave me a lot of advice. And then luckily, Dr. Sozer was in a meeting with Dr. Nayak, and kind of they started talking about me. He gave me a call. I came to, and so Dr. Nayak flew me and my fiance out, or girlfriend at the time, now fiance, and we met both him and his wife. And I would say it had the blend of everything. He's an amazing surgeon, well known, well recognized. He also is exactly who I would want as a senior, someone who can continue to mentor me. So not only is he not a former mentor, so it's not someone who would just see me as a trainee, but someone I could continue to grow and continue to learn especially for facial aesthetics. And then beyond that, I think the biggest thing when you asked about the divorce, I agree, that's a huge thing. And that's something that was a concern of mine. So I was also at that time toying with just starting my own. I will say we met for a weekend, and I'm pretty sure almost like a first date, within the first like 10 minutes, I think we both knew like we hit it off. All four of us were just at just quickly grabbing lunch. And I think we just all four got along really, really well. That entire weekend, we had dinner, we hung out with them, and we just clicked. And I think that was the biggest thing. It was obviously, he's a huge name in plastic surgery. Everyone knows him. He's a phenomenal surgeon, one of the best in the world. But it wasn't really that made my decision. Honestly, it was just how well we got along. And I really genuinely felt that he would, as you said, promote me, help me launch. And I think that was the biggest thing for me.
Yeah, for sure. It sounds like there was some gut instinct for sure that
100%.
led you to make that decision. But then also, let's go back to, you mentioned that there were a few like line items that
Mhm.
you had been brainstorming about what you wanted in your contract. Let's pretend you're giving advice to someone who's finishing their residency, looking at a fellowship, looking to go into aesthetics. What are some of those line items that they should consider
Mhm.
before joining someone more senior?
Some of the big things actually that one of my good friends, Lucas, he was Dr. Calabrese's prior fellow. He told me a lot, but like I said, a lot of my friends. So I think the big things were when we're in training, we're really focused on obviously getting the skills, operating the techniques and all of that. But the business side is there, and we're taught about it a little bit. But definitely, if you're coming straight out of an academic program, your business aspect is your knowledge is very minimal. Even if you do a year aesthetics fellowship or something along that nature, you might have a little bit more like experience with it, or you've encountered a little bit more, but you still don't know too much. And I think talk to a lot of my friends, a few line items were initially you might be wowed by the number that you see in your contract. You got to, no matter what, for every residence, even my friends in general surgery, the first contract you're so happy to get because you're used to getting 50, 70, 60 something $1,000 a year for me, it was 9 years. Anything above that, you're excited, but you just got to look at it long term. What are you actually valued as a plastic surgeon? What is the market rate around there in the city and wherever you're going? How long is the contract? Are there room for negotiation? Are you set at a certain price that looks awesome to you right immediately, but is that for the next 3, 5, 6 years? Is that something you will be happy with? Do you think you're going to make more? Or looking at how always talk to your friends and colleagues in that area, do you think you'll end up bringing in more than you're actually getting back? And so are you not going to be valued for being a plastic surgeon, even though in the immediacy you're like, this is awesome, I'm going to be making a lot of money. The other thing is if you're joining a senior partner that actually does every single procedure that you do, and that you offer, how is the distribution going to be? How is the marketing? So is it really, does he get first say? Does everything go to that senior partner, and then whatever he doesn't goes to you? Is he going to really have the front desk completely like either the first time a console comes in goes to him, next time it goes to you, or how is it going to be? I think that's a big thing because I think there has been, or at least some of my colleagues have told me that they've had experiences where anyone that was an ideal candidate, usually they took, and the people that they did not want to do is who they usually push their juniors.
Mm.
And obviously you don't know that until you're in it, and then you kind of talk more and then you see it and you're like, oh, that's obviously not ideal. The other aspects are who do you have, if you're going into a practice where you're not going into the hospital, who do you have as your staff? Like who's going to be helping you in the operating room? Who's going to be helping you in clinic? will you be getting the same people that your senior partner has? Will they have the same person? Will you have someone else? Another friend of mine had told me that their senior partner, they're in the private surgical center, the senior partner had their first assist, the people that kind of grew up with them, their first assist and scrub that were always with them. However, for them, they had a revolving door of different people. So sometimes that person could suture. Sometimes it was a big case, like a mommy makeover, and he's like, "Oh, can you help me finish the last layer?" And they're like, "No, I don't know how to suture." And that adds on hours to a surgery. And I think certain things like that, which we never think about, because when you're in residency, you're doing what you're attending. You have all the equipment that your attending has. You have the staff and the help that your attending has, and usually the attending's there. So you don't think about these other ancillary things. I think those are really big things to bring up. Outside of that, I think it's just like certain pay structures, looking at bonuses. And I think for me, I still didn't know too much. So having good mentors is a huge aspect. Have as many people as you can review your contract, people that you obviously trust, that you don't want it to fully go out, but like mentors that have private practices. If that's what you're doing, if you're going to a private practice, having mentors that are in private practice, if you go in academics, having other academic surgeons look at it. And then definitely having a lawyer. And I was like, for Nayak and I mean, like I said, he's brought the most genuine human being ever. And even for me, before I've already had that advice, he even told me, he's like, "Oh, get a lawyer, make sure like they look through everything and we'll talk." I had a lot of pretty much most of my mentors that looked at my contract said this is an amazing contract, probably better than they would have given. So I mean, that's amazing advice. And like I had a lot of people that were in my corner. And I think that helps a lot too.
Yeah, so many great takeaways from that. Having an attorney look over it, just because we're not trained in law
100%.
language, utilizing your mentors and, getting multiple opinions, because really we shouldn't have just one mentor helping us. I think having input from so many different people is helpful. And then all of the logistics things like time off, pay, bonus, who you get to work with. You're so spot on that you don't appreciate all of that stuff when you're in training, especially at a big academic institution when you have all these things at your disposal.
Yeah.
And I think private practice is this like wild west where there's so much flexibility, which is a good thing.
Mm-hmm.
But I also think that it's ripe for people getting potentially taken advantage of if they're joining someone that doesn't have their best interest at heart.
Yeah, I agree. And
Which
yeah.
fortunately it doesn't sound like you are in that situation whatsoever.
I got very lucky, and I am very grateful for that. But yeah, I think that really helped, having a lot of people, and even like your seniors while you're in training, people who are doing similar anything. If you're going to private practice, having seniors who went to private practice, talk to all of them. I reached out to most of my seniors. I was lucky that my older brother is actually a plastic surgeon as well, so he looked it over. But the more input you can, you'll see, because I could tell you, even when I was going through contracts, just like every single person that I talked to, and I talked to like over 10, I think each person gave me something that I did ask for. So I think that really, it does help.
So you're about 6 months into, your own practice now.
Mhm.
Talk about where things are at now. What have been some of the great unanticipated things, and then what have been some unanticipated challenges that have come up, either, patient-wise and clinically
Mhm.
or business-wise?
I'll start with the second part. The unanticipated, like when we were in residency, when you're in training, I mean, patients are there. You're getting a lot of patients, you're operating all the time, you're kind of busy. And so I think when you go, especially if you do private practice, no matter what, even joining someone like Dr. Nayak, I still have to create my own name before patients come in. And I think luckily, I think it was faster than probably a lot of my friends, but the first few months it was slow. I was trying to figure out how to just grow, how to get my name out there in the city. And then the other aspect of plastic surgery was I did like social media. Don't get me wrong, but I mostly never posted. I was someone who just used it to look at my friend, like look at like TikToks and things like that. So realizing how much of an importance that is to our field and growing that. And again, it was really nice to have Nayak because he has a huge following. He's really tapped into how to grow in YouTube, Instagram, TikTok, everything. So he's definitely been a great mentor in that regard as well. But I think that was kind of the hardest thing for me, is just like figuring out how, and I'm still working on it, posting frequency, what to post, how to post it, and trying to still show who I am, not completely copying him, not completely copying another influencer per se, but actually being true to myself, showing my patients, showing my followers who I am, not only as a surgeon, but as a person. And I think I'm just slowly getting better at that. But that was probably one of the biggest struggles and difficulties of figuring that out. Because when you start social media, you always feel awkward. You feel
Oh
weird.
yeah.
You're like, oh, I am a couple months into practice and I'm going to teach someone, where like the other posts that you follow are like 20-year senior surgeons that you were mentors who are saying the same thing. And you're like, does this seem weird? It's just getting out there. And I think that ice is hard to break initially. Some things that I thought were amazing was how honestly seamless this transition has been. I think Dr. Nayak and I have said that numerous times, is that he has an amazing system here. Obviously, how he grew his practice, and now just how he's thought of everything. Everything is done for a purpose. And he's been able to completely integrate me into that, where the consult coordinators for helping me get consults and how we do this kind of the initial onboarding for our patients, to or who they talk to, how they get their information. It's been awesome. And then like our team are phenomenal. They're beyond phenomenal. And even though most of them had only really been involved with face, they were able to immediately take, like, from me teaching them how I do my surgeries. I wrote down every step from scrubbing to the final closure and my dressings, and they were able to read it. And to the point where if like as every surgeon, we kind of go away from our exact steps if we have to modify things. Where even one of the scrub techs, the first time she saw that surgery, she's like, "Wait, that wasn't your next step." Like, she studied everything. Like, that is not something I'm used to. They're really, really good. And we've been like, our cases have been going super smooth. The other thing we've been doing here is Dr. Nayak is very comfortable with everything he does IV sedation versus general anesthesia. And so when we started and had our initial contract, he had asked me, he's like, "Hey, if you have fellowship cases, if you're able to do under IV sedation, you should see if you can." And we had a anesthesiologist at Dr. Sozer's. And when I had my fellow case, I did do some under IV sedation, both breasts, liposuction, and they all went very smoothly. And all my patients recovered really well. So bringing that here, we've been doing breast and body under IV sedation. We initially had to make sure, especially for body, we made sure we got a ventilator and had the capability for anything. If God forbid there was any complications, we have the ability to do general anesthesia, intubate, and do all of that. But we have not had to use it. And I'm shocked at how well that's been going. Our patients are healing so much faster. Almost most of my breast patients take nothing but Tylenol, maybe Celebrex. And even my full body lift was and she was like walking the next day. She said she was shocked at how little pain she had. She had no drains. And I'm like, yes, it's some part of certain techniques I've learned from my mentors, but I think the IV sedation has been a game changer. And I think that was something that I'm like super amazed, because the CRNAs, the anesthetists that we work with here are so well trained because they've been with him for so long, that it's been a very seamless transition to do it in breast and body. And I think that's been one of the biggest things that I am shocked in a positive way.
Yeah, I mean, I've been out to his office a few years ago to watch, and yeah, his team is amazing. Um, and just the systems that, he's built over the years. I think that doing stuff under IV sedation, it's something that we almost never do, like in residency. Fortunately for me in fellowship, that's pretty much all we did, except for rhinoplasty. They had a protected airway in.
Mhm.
And so I had a full like year of seeing that and proving the concept before I do it here. And I definitely think patients wake up much easier.
Yeah.
Of course. So you mentioned, so Dr. Nayak is a facial plastic surgeon, just does face, neck, nose. You are full body trained. Are you currently doing any face work? Do you plan to do any face work? What's kind of the mix for you in that regard?
So initially, I started with just breast and body, just because, as I said, as you said, he's just facial plastics. So I wanted to, before doing everything, I really wanted to, one, we had to buy all the equipment that I needed for like full body liposuction, all of my surgeries, and then getting that up to speed. And obviously, also I'm brand new or starting in his practice, so it wasn't that I was operating every single day. So growing that and getting us to the point that we were comfortable with my team and with breast, body, our algorithm of how we're doing it. And unfortunately, it's grown faster than I I even expected. And we've done a lot of surgeries, and every single one has been going smooth. So I think I wanted to do it for at least like 5 to 6 months before I started adding face. Currently, I'm starting to add face, like upper and lower blephs, chin implants, kind of the smaller procedures. I also, even though, as you said, I'm full body trained, I got lucky in the regards of I did spend my 3 years a lot with Dr. O'Daniel, who, although is also a full body plastic surgeon, he is very, very well versed in facial aesthetics, and he is pretty much mostly a facial plastic surgeon in a sense. And so I would say he's phenomenal, easily one of the best also. And so I got a lot of experience with him. With Dr. Sozer doing a lot of these different techniques with the gliding techniques, as well as dual plane and all the different neck techniques. He was doing some mandibular glands, deep neck, deep face surgeries. So I got a lot of experience with that as well. So I got lucky and then through them, I've got fortunate to really get in, see Dr. Andre Arsvold. He's the inventor of the hemostatic net. His brother, Luis Arsvold, Dr. Grading. I was just this past weekend or 2 weekends ago, the Full Face, which is the Brazilian Society of Facial Aesthetics, had a conference here. They invited me as faculty, as I knew most of them. And then I got to even talk to Dr. Tim Martin, who obviously anyone in face really knows. And I feel very, very comfortable with the facial anatomy. I've been around it. I've been in all their talks. I've given a lot of talk. So I think my initial fear, as any regular surgeon always say, is that I felt very comfortable. And if I went off my own private practice, I probably would have started with face immediately. I think it was a little bit of my own personal roadblock where I was like, my colleagues who started their own, in theory, they're going to work their way up before they start doing complete, deep everything. And so it's okay. They can give a great result, and they're kind of graded at their own bar. I feel like I kind of put my own roadblock saying that I could still do well, and I know the anatomy. I probably could go faster, deep, but everything I put out is going to be compared to Dr. Nayak. And I'm like, well, I don't know if I'm at that level. And so I think that was a personal roadblock of mine. But even when I was talking to Tim Martin and everyone that past week, and they're like, you know this anatomy, you know how to do this, you're very well trained, and you have a unique exposure to so many facial plastic surgeons. You should start doing this. And as you said, Dr. Nayak's a phenomenal mentor. He even said, like, once you start, he's like, I'm here for you, whatever you're doing. Like, I will be a personal mentor to you. I'll be there if you want me to. And that's something that I think anyone in the world would love, to have a Dr. Nayak watching you and walking you through if you need any help in a face.
Yeah, for sure. So let's talk a little bit, like, when you join someone that's so well known, who has these like really incredible prices, somewhat, how do you price your surgeries starting out? I mean, do you go off more of kind of the quote unquote market? I mean, has his team, his patient coordinators, have they been helpful in terms of deciding where you wanted to start things at?
Yes, they've been super helpful, I think. And basically, that what you said about the market price is kind of what I'm doing. Definitely not coming out of the gate charging anything remotely near him. I'm basically using the price, kind of putting myself in the middle of the prices of the market prices. We can see what a lot of the surgeons in town, obviously we have WashU and a lot of plastic surgeons in town here. And so we set my prices immediately kind of in the middle of the road for everything. I think is the best thing as a newer plastic surgeon coming in, starting, regardless of the fact that I'm here joining someone like that. I don't think it's a smart move to just start charging extremely high. I don't think that's right for my patients, and I don't think it's right for me while I'm starting.
Yeah, for sure. I kind of started in the middle and then just use market economics. I mean, as the demand went up, so did the prices, because the supply stays the same.
Exactly.
You're one
Yeah.
person. So, and I think it's a little bit hard for patients to conceptualize such rapid, like, I'll say from my standpoint, my facelift prices have like fourfold increase since I started,
Mhm.
which is kind of cool. Patients can sometimes get upset about that, but it's like, well, really, I was underpriced to start with. It's in a certain sense, based on your
Yeah.
how well trained you are. And I think that in taking that increased price and investing it back into the practice is so helpful for future patients.
Yeah.
You can spend more time with them. You can invest in these adjunct treatments like hyperbaric oxygen,
Mhm.
more nurses. Do you guys use any post-op nurses that like go home with patients for a certain period of time? Or what are some of the extra things that you guys do in your practice to help encourage the healing process?
Yeah. So actually, a lot of what you mentioned. So we do have a hyperbaric oxygen chamber, and so we actually, and I got lucky with Dr. Sozer. Actually, got one during my fellowship with him, and I will say I was a little skeptical initially, and I think he was too. But we saw how amazing it was, and especially anyone who had a little tenuous type of wound, even like the early onsets of what you think might be like nipple necrosis, putting someone in even though they're not the full hyperbaric that you use for like diabetic foot ulcers, it's a little lower in the atmospheric pressure. It was phenomenal. It really allowed people to heal better and less bruising. And so that's something we have here. Dr. Nayak has been doing it for many years. He has it here, and he usually offers it to almost all his facelift patients if they like it. So that is something that we have. Manual lymphatic massages. We do have our estheticians trained in that. So initially they had been trained for all the facial patients, so they would offer that. And then earlier in a few months ago, and actually just this past last week, we had the Brandy, who's an amazing trainer. She came out and taught them how to do all of the body manual lymphatic massages for my patients, because I think it's a massively important for liposuction patients and my body lifts or abdominoplasties after they heal, to help really give them that next step in results. So that's something that we offer here. So we've been teaching them to get them up to speed. Outside of that, we do have post-op nurses. They're not actually any of our nurses. But it's a company that we've been using, and that Dr. Nayak has been using for many years. So it's pretty much the same, even though they're a bigger company, there's the same set of nurses that he usually uses. He's personally vetted them, he's talked to them, he's trained them, they know what his protocols are for his patients. And so that's an offer for patients, especially those who come from out of town. They usually stay in an Airbnb or a hotel nearby. Again, we have a few places that we recommend. And those nurses work 8-hour shifts, and definitely for the larger surgeries, they're there for the first 24 hours, and then they can be extended if needed.
Yeah, I think, things like hyperbaric lymphatic massage, those are things that I tell patients. I'm a little bit of a skeptic. I think they do help a little bit. But also the whole like placebo effect of having people come into the office,
Mhm.
that extra TLC that they're able to spend with your team, those extra like
Mhm.
minutes of reassurance of like, yes, this looks normal, you're healing beautifully, because it's such an unknown process for them.
Yeah.
They only go through these big surgeries maybe once or twice in their lifetime. Whereas for us, we see it every day. We're like, oh, yep, that's normal, not concerned about anything. But I think hearing it from their surgeon is one thing. Hearing it from the rest of the team, I think just helps the patient build confidence in like their recovery in
Yeah.
general.
No, I completely agree. And I mean, we both have heard of practices where you meet the surgeon probably the day of surgery, and then they operate on you, and you might not see them again for 3, 6 months, and you're only seeing maybe their nurses, or you're just virtual visiting someone else on their team. I think this is, as you said, we're calling them in. They're coming in, they're seeing either me, they're seeing our team, they're seeing how involved we are with their care, that we genuinely care about them. It's not just caring up until their surgery. We care about them until they heal and afterwards, and they're pretty much our lifelong patient. And so we're kind of on their team, and I think that really sends a big message to them, and also makes them feel a lot more comfortable.
Yeah. Um, so let's switch gears a little bit here and talk about kind of a sticky topic.
Mhm.
It's managing either the patient who has unrealistic expectations before
Mhm.
surgery and kind of telling them that I don't think I can give you what you want,
Mhm.
or the patient who's unhappy after surgery. Either they had a small complication that you had to work through together, or they're unsatisfied with the result. I mean, how have you dealt with some of those early challenges, or have you had that happen yet?
As for well, I can go in order. So initially, yes, I have had patients that have either unrealistic expectations. I think any surgeon or any of us in residency have done that too. And so I think more so in private practice and aesthetics, you really have to dwell on that. Like, tell them exactly what you can offer. The more pictures you have, obviously, when you just start practice, you don't have a lot of before and after, so it's a little tougher to show that. But you can use other pictures, other surgeons' pictures, just to give them an idea initially. And then as you grow your portfolio, you can start showing them exactly your own patients. I think that's huge, giving them an idea. And those that 100% are not getting it, that still have that unrealistic expectations, I would say either you tell them you just can't, maybe they should find someone else that you really can't give them. But what I've found is at least I would meet them a few times. And usually I'm in line, or I tell patients, I'm like, hey, you initially were telling me this. I'm telling you something different than what you had come in with. I think we have a great plan, but I want you to go home and think about it, research it, look into it more, and let's set up another appointment and have another second consultation where we'll talk about it even more. And I think that's actually gone really well for me. Because they do. I mean, everyone has Google, everyone has ChatGPT nowadays. You can get a lot of information. And so instead of it just hearing for the first time from me, they can go home, look this up, and we talk again in another consultation. I think that's really helped me manage expectations. And so far, it's been a really good move for me. As for the after surgery, I think being honest, I think that's and as simple as that is, I don't think that's always the first thing or first word that comes into mind when you think of a plastic surgeon. But being truly honest with them. So if they bring something up and they are unhappy or they see some asymmetry, telling them, not trying to sell them and say, no, you look great, being honest. If you see it, say, I completely see what you're saying. And then tell them what your recommendation is. And that's what I've always done. That's how I was trained to do, is like, yeah, I'm going to validate your feelings. I see what you're saying. However, if it's something within the normal and that you don't think it's worth going after, tell them that. Say, hey, I do see it. It's maybe 2 millimeter little asymmetry. However, nothing is 100% symmetrical. And we could potentially do something, but it probably would cause more harm and might not still result in a perfect symmetry. And telling them, like, validating their feelings and then telling them why you would not change it, versus the unhappy patient says she doesn't like something, you see it and you're like, at least I could tell you, if there's something a patient doesn't like, I probably already have noticed it and I don't like, so I'm happy they brought it up. And I will always validate and say, let's work together. Let's figure out what the next step is to fix it. Usually the biggest thing I've learned in training is when you're in residency and you see something like that, your immediate gestalt is to let's go back to the OR right now and let's fix it. And that is not the right move. You need to give it time. One, I've been shocked at seeing things initially from mentors and things where I was like, oh, I don't know if that looks great. And they're like, just give it time. And it looks phenomenal, like 6 months later. And I was like, oh, I would never have thought that. So, and then other reason is, obviously, to go back too early, you can cause more harm. You need things to settle in. So, but being there, if you know that there's an unhappy patient, everything that we learned, talk to everyone, meet them more often. I give everyone my personal cell phone number after surgery. I call them personally the night of surgery, sometimes the night after, and I tell them, you can text me, you can call me at any time. And if they have an issue, even my patients for fellowship, they have all my cell phone numbers. And I tell them, hey, if something comes up, I'm not there. We can figure out a way. If you can either obviously fly to St. Louis, or I can see what I can do to help you there. But that's kind of been my kind of way to handle this, is I think being available and not just going away, regardless if they're happy or not unhappy, just always being there.
Yeah, it sounds like our styles are pretty similar. And I don't know if that's, just the next generation of young surgeons. But I think I do a lot of the same things. And I don't know if I was outwardly shown any of this. Sounds like we had pretty different fellowship experiences. I kind of was brought up in this like gaslighting situation where he would tell people like, I don't see what you see, get lost, essentially. And I was like, oh my God, I wanted to like melt in the corner of the exam room, because I was like, well, you know, I do see what she's saying, and you probably see it too, but your ego is so big that you're just gonna pretend like you don't see it. And I think it's hard professionally, because just like you said, if there's like some little something that a patient sees, you see it too. I see it.
Yeah.
Like we're the biggest perfectionist in the room, and sometimes it is a relief when they bring it up.
Yeah.
Now, some people are super happy, which the goal is for a safe outcome and a happy patient, right? In cosmetic surgery. So if there are little things, sometimes I don't say anything, right? It's because the
100%, I
patient's
agree.
happy.
Mhm.
But when they do bring it up, it's a great opportunity to sit down and say, I see it. What are the options here moving forward? Because we're on the same team.
Yeah, I
And
exactly. Mhm.
yeah, I think those conversations I think the patients also feel a sigh of relief when they like the minute you say, "Oh, I do see what you're saying," because
Yeah.
they're coming into the appointment nervous, sweaty palmed, thinking, "Well, they're going to disagree with me. I don't even know if I should bring it up." Um, so yeah, I think
Yeah.
I'm hoping that's just this next generation of plastic surgeons. We're so open and honest with patients.
I agree, and I agree with you. Like the goal is to make the patient happy, and our eye sees every little asymmetry, and no matter what, nothing's going to be symmetrical. So you'll see what's not. So if they're very happy and something small, I'll never say anything. But something that I know a few of my mentors have also said, even if sometimes they might not bring it up because you're their surgeon, they don't want to offend you, they don't want to hurt. Like so they're like happy, but like there's something off. If there's something that I think is actually like, and I haven't encountered this yet, but this is what they've told me, like enough of an issue, but I think it's an issue, something that we can fix and make better, but they don't bring it up. I will say, it's like, hey, could I make one suggestion? Like, I do see something. It doesn't
Mhm.
need to need some fix, but I do notice this, and I think we can give you a better result. And if you're interested, this is what we can do. And so that's the only time I bring something up. If someone is happy, doesn't bring something up, but I think it's a noticeable enough issue that I think we could fix.
Yeah, another thing that you said that I think is interesting and probably a good suggestion, whether someone is a surgeon listening or a nurse injector and is listening, when your spidey sense goes up, that perhaps your abilities, your practice, your style isn't compatible with the patient's expectations,
Mhm.
not necessarily just immediately dismissing them, but potentially not treating them that day or not offering them surgery that day, and then offering them another appointment, another consultation to come back. Because I think it's really hard to assess someone's expectations in a 1 hour window.
100%. Yeah, I
And
agree.
so showing them that you do really want to understand their expectations, you want to make sure that this marriage that you're joining them in, if they do like if they do go under the knife, that you guys both have a great relationship before surgery so that you have that trust in each other for
Mhm.
after surgery. Yeah.
Yeah. Oh, and then the only thing I didn't say in that before was you just made me think of it. If there is something that they ask that I either think there may be something to improve, but I just personally do not offer it, or I don't know what that thing is, I always tell them honestly. I don't try to BS them or make up, oh yeah, I can do it, or make something up. I always tell them like, hey, I don't. There may be something, not that I've read, but I have luckily a lot of mentors, and now I've been to a lot of these ISAPs meeting, the International Society. So I reach out to friends throughout the world and be like, hey, I've had this patient. This is what they came to me. Do you know of any non-surgical or surgical options for something that could help them? And then I'll tell them that. And I even say, I mean, they always that we all get the patients like, oh, I'll be your guinea pig. And I'm like, I don't like to say it like that. I'm like, I want to make sure it's tried and true, and I've seen good results, and I've really studied it, and then we can rediscuss. I'm not just gonna hear something and just go ahead and try it.
Yeah, the fact that we have such this huge network of senior mentors and we've got the world at our fingertips essentially with these groups that we're a part of, it's really a resource that is, I mean, it's incredible.
Mhm.
Years ago you didn't have access to your mentors like we do now.
Yeah, I agree. I mean, that really helps us kind of go to the next level, which is kind of the hope for our entire field, that we continue to progress and go forward.
So you mentioned that you've been kind of putting your feet into the pool of marketing yourself with social media. Talk about what apps have you found the most helpful in getting patients in the door?
I'll say mostly I've just used Instagram. I have a very minimal posting to TikTok. I know you have a very great TikTok, and I think a lot of people, and especially in our age, I think they said that they have grown more on TikTok, which maybe that was my fault, that I should have used it more. But I think as I was getting my foot wet into it and just dipping it in, I just kind of went headfirst into Instagram. So, and that's been really helping me. I will say that I'm not as consistent as I should be. I'm trying to figure it out, but it takes me hours to edit a video. And so it's hard for me to post every day. But I can say that as I've slowly grown, once I start posting, I've seen so many like either direct messages or patient inquiries that have either asked me questions, and that has led directly to a consultation.
Yeah, you mentioned TikTok. My heartbeat stopped for about 3 minutes solid a while back when for the audience, we're filming in early February right now. But TikTok went down for like 24 hours. And it's just such a good reminder that we shouldn't put all of our eggs in one basket and that these apps potentially are these fleeting things that could be turned off or shut down or bought by another company. And so
Mhm.
I think diversification with marketing is wise in any industry.
100%. Yeah. I'm hoping nothing happens to Instagram because right now that's my only thing.
So let's fast forward. What are some big goals you have for yourself? Where do you see yourself in 10 years?
So actually, I hopefully see myself here. As you said, I know the divorce rate, and I always joke around with like all my friends, like that is what we've seen. But I will say, like with Nayak, it feels like family. I mean, my fiance, and his wife hang out fairly often. We have dinner. Like it's a very different vibe than I would say most of my friends who have senior partners experience. He does remind me a lot of my mentors as well, which is awesome. So hopefully here for 10 years. I think as I build, I do want to do facial aesthetics. So I'm already slowly I started booking a lot of blepharoplasties, but I think it would be not too long until I start doing neck lifts and facelifts. And I do enjoy that anatomy. I've been in so many courses. I also have written a lot of papers and been involved in that. That's something I really love. So I think that will be a big part of me. I don't want to give up breast and body. I still think I'll still offer breast and body. I think I'll tailor down and not do everything, but start finding procedures once I get after my first many years, really tailoring down to the procedures I love doing. And I do love doing everything right now, but it's not feasible to be a master of everything. And so I really want to tailor down to a handful of procedures, facial and breast and body, that I can provide the best and not just trying to be the jack of all trades.
Yeah, that's one huge gift of growth is that you can niche down your practice to exactly what you love. I gave up rhinoplasty almost a year ago. I
Mhm.
never thought I would be able to do that as a facial plastic surgeon, but I just didn't like it. I mean, those cases I literally hated. I felt like I was good at them, but the internal anxiety, like the night before, planning out like what you're going to do. I mean, rhinoplasty is just such a bear in the OR.
Oh, I know. And I actually, so I left that part out. I probably on the same page as you. I don't know if I'll offer rhinoplasties. I love doing them. I love doing them in residency. I like doing them in fellowship. It's just that, as you said, it's a huge undertaking. And for such a, like, even for a millimeter, like change, it's such a massive change for the patient. And I will say, I think ENT facial plastics, certain surgeons that pretty much only do rhinoplasties are phenomenal. And I think
Mhm.
both the facial plastics and the general plastics will probably admit to that. But there's a few handful of surgeons that we all can think of that pretty much their entire practice is rhinoplasties, and I think they are phenomenal. And I don't think I will be able to offer that. So I think I would rather refer someone to that than do it myself.
I also think that a lot of like great and self-critical surgeons recognize that you have to be good at the chip shot cases, the chip
Mhm.
shot rhinoplasties, but also to be a good rhinoplasty surgeon, you have to be very good at managing secondary revision, complex
Yes.
cases. And I think that's where, at least for me, where the complexity and challenge was a
Yeah.
little too much for me. Whereas with the face and the neck, give me a revision, give me a complexity, I'm all there for it. But with the nose, I was like, "Ugh, I don't know."
Yeah. No, I agree. I mean, I've had someone in Louisville who would do Dr. Katrib. I think he's a phenomenal surgeon. I would see some of his cases booked for so long. He's taking like ribs and just like where he goes into like an eighth revision and they have zero structure and he's there and he fixes it and makes them look like they've never had surgery. And I'm like, wow, there's no way unless I start just doing noses for a while that I could get to that level.
Oh, for sure. I think he's one of the best rhinoplasty surgeons of our times. Yeah. Well, I noticed that you're in your new office that you posted here recently on
Yes.
Instagram. I noticed that you had a Kobe Bryant quote on the wall. What
Uh-huh.
does it say? What does it say?
Says Mamba mentality is all about focusing on the process and trusting in the hard work when it matters the most.
That is what we're going to leave with today. Well, Dr. Kachari, thank you so much for opening up, letting us get to know you a little bit more. Congratulations on the engagement.
Thank you.
Congratulations on the first 6 months of your practice. For those of you who don't follow Dr. Kachari, go follow him on Instagram. He's located in St. Louis. If you're interested in the breast, body, or face work, he's at Nayak Plastic Surgery. Dr. Kachar, anything that you want to leave our guests with today?
I would say thank you for having me on this podcast. It's always, I've listened to so many of them, especially after you told me and I was going back. It is a great podcast, and I'm just happy to be able to give some information on like kind of the newer part of the practice and kind of maybe the newer age of surgeons just coming out. And as you said, you can follow me, but if while you're starting a practice, if you ever need any advice or help in either thinking about your contract or just how to choose, you're always welcome to ask me.
All right, thanks.
Thank you.